So we've discussed all of the challenges that you can face when you're a caregiver looking after somebody with dementia, and it can be overwhelming. And I want to reassure people that it is a challenge that when you have a few simple tips can make the difference between total frustration on a daily basis to something you have confidence that you're able to manage. Caregivers are the unsung heroes in our world, and we're just so happy that we have so many people willing to take on the responsibility out of love and concern for those who are dealing with difficulties with dementia. But there are some practical tips that we can use. Health professionals get an amazing degree of training in order to be able to do all of these things. It's in fact a master's degree for physiotherapists and occupational therapists to learn how to do the skills that we're talking to you today. So if you have some frustration, we don't want you to feel guilty. We want you to know that we know how hard it is, and we're just trying to make things a little easier for you and for the people that you're looking after. So we're going to start by talking about practical tips for helping people get up and get to the toilet, because we know that that happens on a regular basis, and it is the biggest challenge that we're facing. Getting things prepared ahead of time always make things simpler. And it helps if both you and the person that you're helping have a similar routine every day, so that the commands, the time of day, the actual process that you're going to use is as consistent as possible, so that they can learn to anticipate what's coming next. So we want to make sure that we start with good eye contact. Don't assume that because you're saying something that they're actually listening and understanding what you're saying to them. Speak slowly, use a few words, stop to be sure that they know what you're saying. A lot of seniors especially have hearing issues, and if they don't have their hearing aid in or it's not turned on, they may not know what it is you're saying. Use gestures, but keep them to a minimum so that you're pointing perhaps to the bathroom and not gesturing wildly with your hands so that it confuses them. Say one instruction at a time, slowly. Look to see if they've understood what you've said, and you'll get to know this as time goes on. One of the challenges that we see is when people have a number of different caregivers, and one's very slow and patient and gives the person time, and another one might be in a rush because of something else that has to be done. We want to try to be sure that we do the same thing every day and that everyone is doing the same strategy. Listen to what they're saying to be sure that they understand what it is that you want them to do and that you understand what it is that they're asking for. So allow them time to hear and to move. However, if somebody needs to go quickly, sometimes there's no time for all of the proper strategies. You just need to make things happen. Repeat things as often as you need, and try not to get frustrated that you might have to say it 3 or 4 times, because that's maybe how long it takes before they understand what's going to happen. If you can't get them to cooperate at the moment and there's no urgency, you can always come back and try again later, after lunch or after a meal, when you know that they might be more receptive. You need to allow sufficient time for all steps, so the more prepared you are, the more the environment is set up for success, the less urgent things become. But if somebody needs to go, sometimes there is no time for the best laid plans. So sometimes it's beneficial to have a toileting schedule, much as we did with our children when they were small. It can help to avoid accidents if you have a sense of when the person often goes, and even keeping a schedule for other caregivers who may come into the home will let them know when someone has already used the toilet. Usually we like to try to plan for toileting about every 2 to 3 hours, but everybody's going to be different, and certainly the time you drink your liquids and have your meals is going to impact that. It also may be impacted by the medications you take. Some people may be on medications that create a bladder urgency because they're on fluid pills. So you get to know what time of the day people go. And keep a list and a schedule discreetly so that others who are providing care also know when those times are coming. And try to maintain the person's privacy and dignity by keeping the schedule out of sight and just making sure that it's available to those who are going to be helping. The more you plan ahead for everything, not just toileting, the better the day will go on a consistent basis. Please keep the lights on in the hallway and all the rooms, because our balance and our ability to walk safely is entirely dependent on how well we see. And a lot of seniors especially have glaucoma or cataracts, or their vision is fading, and so it's difficult for them to see anyway. So keeping the lights on, not just little glow lights that plug in, but full lights, makes things much easier. Always keep the pathways to the bathroom and everywhere else in the house or apartment, for that matter, free of clutter. No throw rugs. Make sure that there's no shoes or purses or anything else left on the floor. Make sure that the bathroom is set up and that there's nothing in the way. There's no distractions and having things all over the countertop to take away their attention, so that the goal of just getting to one spot is very clear. Use all of the aids that can be used to help the person get to the bathroom safely, to help them get down onto the toilet and back up again safely, and we'll go into that in much more detail. Always make sure that the person has proper footwear on. That's not flip-flops or slippers. That's therapeutic footwear that provides lateral support on both sides of the feet, and a good heel cup to keep the foot in place when they're walking. And have those on ahead of time, not when somebody says, I need to go. Consider using incontinence products for somebody who always seems to be rushing. You don't want them having to run to the bathroom, trying to get their pants down on the way because they're afraid of an accident. So using those products can make them feel more confident, and you can both take your time. Use easy to remove clothing for those who have difficulty with that. If somebody has balance issues, the hardest thing they can do is to try to let go of their walker or cane to try to get the belt or their pants down. And so we don't want tight clothing as well. And buttons and zippers just add to the stress, and so slip-on clothes are much more practical. So these are just some examples. You can use Velcro for instead of buttons or snaps. And you don't want to use things like belts. So you want to have things that are just going to come down. So sweatpants or pants with a stretchy waistband are often the most practical thing for people to use. Sometimes wearing a skirt for women is easier, because then you're not having to pull anything down and you're able to get on the toilet a little quicker. So these are just some other examples. So sometimes they're not in their pajamas, but if they happen to be, then a top pajama that comes down to the knees is easier to get somebody to the bathroom. So sometimes toileting is only difficult at night, and if they're getting up 2 or 3 times in the middle of the night, that disrupts the caregiver's sleep, and so we want things as simple as possible. So this kind of clothing at bedtime can often make the difference between getting up to the bathroom and back to sleep quickly versus turning it to a half an hour trial. These type of clothing are available at specialty stores. You can order them online, and they're at some health departments in the drugstores around your community. And so if you're not sure where to get this type of thing, you can call your occupational therapist and they will be able to give you that information. One of the things that we say in healthcare is that you don't move into a nursing home when you can't walk anymore. You don't need help to be in the home all the time if you can walk. You need it when you can't get out of your chair. So every lecture that we give, we talk about the golden rule. If you can't get up from a chair by yourself, you will have difficulty living by yourself. It is one of the hardest tasks. It puts all of the strain on your wrists, which are sometimes sore from arthritis, on your elbows, shoulders, and neck. And if you have weakness in the legs, you most often have weakness in the upper body as well. So we want to keep people as strong as possible. So we're talking about compensating for loss, but at the same time, we also want to focus on keeping people as fit as possible. It's true for all of us, but it's especially true for those with dementia. The stronger they are, the less strain it will be on them and all of their caregivers. Golden rule number 2 is that if someone else is strong, you don't have to help them as much, and everything will be easier. So getting them to do exercises, getting them involved in doing things in the home that they are able to do, like folding the laundry, putting away some dishes, anything that helps them pick things from the counter and put them away, that keeps them on their feet, moving and strong, that will help reduce the difficulty when it comes time for toileting. Golden rule number 3 is that you will change how much you have to help them by how well they've slept and how well you've slept. So oftentimes we see caregivers who are functioning just fine during the day, but they're helping the person with toileting difficulties 2 or 3 times in the middle of the night. And that's draining on everyone, because the less sleep you get, the more tired everybody is, and the more you have difficulty walking and balancing. Often, if you have to get up in the middle of the night, you've taken medication to help you sleep, and so you may be drowsier, you may be dizzier because you're waking up from a deep sleep, and so there's a lot more complications in the middle of the night, and so we'll talk later about strategies to help at that time. If you can, you want the person to sleep as much as they can. If they need to nap during the day, research has shown that that helps, both with cognition as well as with their energy level throughout the day, and that translates into better balance and more independence. So we need to protect the caregiver's sleep as well as the person with dementia. So what assistance is needed to help someone get up? That's the critical feature. How much help do you need to help the person walk? Because that's the first step. We have to get from point A to point B, whether it's from their bed to the bathroom, the living room to the bathroom, or downstairs, upstairs to the bathroom. So there is the situation where you don't need to help the person with dementia at all, and that's obviously the optimum. But it goes all the way down to someone is not able to get to the bathroom at all and has to use Depends or a commode in their room because they cannot get out of bed. So we have 7 stages of caregiver help. The first one is that the person gets up with no help. The second is that they're starting to need a little bit of help, and that may be early in the morning or later on at night. The third is the individual gets up with a lot of help. And you'll notice that these directly match the levels of frailty. So as someone's level of frailty progresses, the need for help when they're going to the bathroom also increases. So we go down to where they need help from 2 people, which then creates a whole lot more challenges, because most people who have someone living with them only have a spouse or a child or one other person. So when you get to the point where you need 2 people, that creates a whole different strategy. At some point, some people do progress, not everybody, to where they need mechanical lift, or a Hoyer lift as we call it, to get up out of bed and onto the toilet, and we'll talk about that. And then there are those who simply can't get out of bed, and sometimes that's only temporary. They may have had a fall, which injured them temporarily, or they may develop pneumonia on top of it or another health issue, and so just for a short period of time, they're not able to get out of bed. So it's nice if you know that that sometimes happens and what you might do in that situation. So we're going to talk about the person who can get up on their own and what role a caregiver might have in that situation. So in this situation, you just want to facilitate and maybe encourage. You again want to keep the lights on all the time. Don't turn the bathroom light out even in the middle of the night, because they may get up and wander to the bathroom on their own. If they have a call button, or if they're supposed to let somebody else know, they won't know to do that. And so we do not want them having to worry about turning on the lights. You want to make sure that the floor is clear and the hallways are clear of clutter. Make sure that you set out their clothing that's easy to get on and off, so that they're not trying to do that at the time. Make sure that they're wearing their glasses. People forget that all of the time. You need to see where you're going, because that improves your balance and your strength. And you often need to remind them to use the bathroom, because sometimes they don't have the sensation that they need to go. And sometimes just a gentle reminder, not asking, do you need to go, but how about we go to the bathroom? And even if sometime they don't need to go, it's still good practice. And then, of course, always make sure that they're wearing proper shoes, and that's for everything that they're doing. But most people that we see are starting to need a little bit of help when they get up. We don't want to give them too much help, and we don't want to jump in when we don't need to. And we want to respect that they may want to try to do things that we're a little uncomfortable, but they need to do it, even though there's a little bit of a risk. So we do call it a falls reduction strategy when we talk about strategies as opposed to falls prevention, because the risk of somebody falling with dementia is very high. It's about a third of all seniors fall past the age of 80 every year, but those with dementia, it's almost twice as much. So I want to reinforce that you could do everything right, and that person may still have a fall, and it's no one's fault. It's just the natural part of aging and the risks that we take, trying to be as independent as possible. It still is a very stressful thing when it happens, and we're going to talk about how to prevent that later on or reduce the incidence, but it will happen at some point, and we need to know that it's no one's fault. We just need to do as best we can to help them. So if somebody needs a little bit of help, setting up the room for success, whether it's the bedroom, the living room, or the kitchen, makes all the difference. So the first thing an occupational therapist or physiotherapist does when we go into someone's home or residence is we look at the height of all of the furniture. If you're sitting in a rocking chair, you're not going to get out of that as easily. If you're sitting on a comfy couch that sinks down and you have to push really hard with your arms to get up, that's just wear and tear on your upper body that we don't need. So we can raise furniture up with those little blocks that are underneath that bed there. You get them from all the home health departments. They're about $125, but they can make the difference between somebody needing help and somebody not needing help. Sometimes you might need to just stabilize them a little bit when they first stand up, and that may be all they need, because once they're up, they're good to go. I prefer to have people get a railing for their bed, because then you're not having to do that as a caregiver, and they feel safer because they can hold on to something. And whenever they can hold on to something, their confidence in themselves goes up, and they're much more likely to stand up and try to do things independently. So the railing there in that picture is called an M rail because of the shape of the top of the rail, but there's all sorts of railings that you can get. And some of the equipment that we're mentioning today can be borrowed for free from the Red Cross. It does need a prescription from an OT or a physiotherapist, but those are also options for people who might just want to try something to see if it would make a difference. So the next level is when the person needs a lot more help to get up. And that's usually when you see physiotherapists and occupational therapists getting involved, because we're trying to help the person compensate for what they've lost strength and mobility wise, as well as to do the rehabilitation to try to keep them as strong as possible, and to train the caregiver how to look after them, because we can teach you some of these practical tips one-on-one. So now we're getting into the area here at level 3 where there's a risk to the caregiver injuring themselves. And unfortunately, we see that happen a lot because the caregiver wants to help really quickly, and they may not have had the training on how to transfer someone. And there are courses that we teach on how to transfer somebody, and yet we expect the caregiver to somehow intuitively know how to do this. And that's what this whole series is all about, is that this is not an easy skill. You can't just watch a YouTube video and look at it once and know how to do this. This is a skill that comes with a lot of practice. And so we want to acknowledge that whenever you are doing this, we want you to be as safe as possible. So you'll notice in a couple of these pictures here that the person is using a safety belt around the person's waist. That just extends your reach. It means you're not pulling on the shoulders, because we see a lot of shoulder injuries when people have either fallen or you're trying to help them get up and you pull on their arm. This takes that away. It also is a soft belt that's comfortable, and so it's much more dignified to use something like this. In these two pictures, you will see the caregiver standing very close to the person, and that's an essential key. And when we do the practical demonstration, we'll talk about why. The closer you are to the person you're helping, the less strain on you and on them. You have to talk them through the sequence, one step at a time, until they get to learning how to do it instinctively. Having said that, there are those that we've seen where we practice and do this every day with them, and it's as if it's the first time we've ever done it, and we cannot get frustrated with them for not remembering, because that is one of the essences of having dementia, is that you just don't remember what the steps are. So what can you do to help at this stage? Whatever the assistive device is that's been prescribed, to the person with dementia, make sure it's there. Sometimes people have one on both levels. If they have to go upstairs to the bathroom, you have a walker downstairs and one upstairs, and make sure it's close by. There is a dilemma of whether we leave a walker next to somebody with dementia who might not remember to use it or use it correctly, but that's a discussion that you would have with your healthcare provider. You put the safety belt around the person's waist before they get up and try to get them to do the shifting forward so that you can reach around them. You always make sure that the person has their feet apart because that makes them more stable, and that's for every transfer, whether it's to the bathroom or not. You tell the person in simple words what you're doing, and you say, on the count of 3, we're going to stand up 1, 2, 3, and you're going to use the handles on the belt to help bring them up rather than using their shoulders. If you don't have a belt, then you can sometimes put your hands behind their back, below their shoulder blades, as a way to protect the shoulder.
Okay, so at the 4th level of helping someone, or the level of assist for someone with dementia, is the person, in order to get up, they need the help of 2 people. So this, we're getting into obviously higher risk because you're introducing a new helper into the situation, but there are some good tips and strategies that you may find helpful to lower the risks involved with helping someone stand up when it takes 2 people. So here are a couple tips that you can do to help. So before starting, decide who is going to be the one in charge and actually lead the transfer. And I guess before I go further, so when we say transfer, we mean a change in position of the person. So that could mean from going from a lying to sitting position when you're in bed. It requires a lot of physical abilities to be able to go from lying to sitting, but it usually means transferring from sitting to standing. And so as you can imagine, we change positions from sitting to standing often throughout the day, and obviously we need to be able to do that for getting on and off the toilet or in and out of bed or on and off a chair. So decide who's going to be in charge when there's 2 people helping the person transfer. It might be the person who knows the individual the best and how they move. They may have more experience with transfers and feel more comfortable taking the lead, or they might be the stronger or sort of larger person and in a better position to help with the transfer. And also, we're keeping in mind that a lot of this depends on the heights of the people involved, the heights of the person you're trying to help, communication styles. And so there's a lot of different factors involved when you're trying to facilitate a transfer that can make or break the success of the transfer. So make sure that you've got all of your aids and mobility devices needed and have them within reach and set up properly. So for example, if you have a floor to ceiling pole that's required and there's a horizontal bar attached to it that needs to be in the right position, make sure that that's where it should be to help the person stand before actually moving them. So if there's a commode or wheelchair involved, if that's the destination for the transfer, make sure that it's right beside the other seated surface, like right beside the bed, ideally at 45 or 90 degrees or as close as possible to where they are. If the individual has a weaker side, so let's say they've had a stroke in the past or they've had a condition that has affected their muscle strength in their right side more than their left, then you may consider transferring them towards their strong side. This helps to optimize that safety and success of the transfer. So it's all about understanding what's going to help the transfer the best for success. So communicate with each other who's going to do what. So for example, I might say, I'm going to help them on their left side, you help them on the right, and guide their bum towards the seat. Tell the person who you're helping what you're going to do before doing it, especially if they become easily anxious or scared while being moved. I've found in practice, and I'm sure caregivers see this all the time as well, is that when the person that you're trying to help feels more calm and comfortable and confident with you as a helper, the transfer will be more successful, and they're usually likely to be more independent, or at least to take risks in that standing and moving. So try to make them feel as comfortable and calm as possible. So you want to make sure that the 2 helpers or caregivers are strong and experienced enough to be able to help the individual transfer when there are 2 people involved. So the next level of assist is when the individual is just too impaired to have two people help them manually, and they need a mechanical lift instead. So sometimes at the point of having two caregivers involved, it's just too unsafe and unpredictable to help someone transfer. So a mechanical lift can be used. You may ask first whether it's worth the time and effort to use a mechanical lift to get to a commode or toilet, when the person may not have the ability to actually sit upright without being supported anyway. So you're thinking, what is the destination if I use a mechanical lift, and is it worth the time and effort involved? You may consider toileting care in bed instead. But that's something that if you know the person and the situation the best, or if you have a healthcare professional involved, they can help you make that decision. So usually these are used when the person requires two people to help them up, and they're going to another seated surface like a supportive wheelchair or a lift chair, to have a break from being in bed. So the lifts aren't meant to be moved more than a few feet with the person in them. So as you can see, there's a lift and there's a sling involved. So the sling is under the person and hooked up to the lift, and that enables the person to be moved from one spot to another. If the destination with the lift is get to a toilet, a commode, or a shower chair, there are personal hygiene slings that come with the lift, so that there's an opening in the sling around the private areas of the person to facilitate toileting or bathing. So using a mechanical lift takes knowledge and training of the person or two people using the lift. Sometimes I've seen people use a lift with one person, one caregiver, but it is ideal if there are two people involved. One to be able to move the lift around, and the other to make sure the person is positioned properly in the sling and doesn't get too anxious. So consider only helping the person with the lift when they're well rested. Because there can be lots of bending or moving while using the lift, if the person has pain already, try to time using the lift after pain meds have been given. Prepare the person's clothing as much as you can ahead of time. So if you're going to a commode, you'll have to pull the person's pants and underwear down or lift up their skirt or gown first before lifting up into the sling. So move the lift and position the person as quickly and safely as possible. As you can imagine, most people don't like the sense of being up in the air for too long, and it can cause them to become upset or agitated. So again, you're thinking about the destination and whether it's worth using a mechanical lift. Maybe a bedpan, a portable urinal, or incontinence products in bed would make more sense in your situation. Now, there are other devices that can be used to help with transfers. This is where you may seek out some help from an occupational therapist or physiotherapist to help you decide which devices would be useful and safe in helping the person. For example, a sit-to-stand lift may make the transfer easier and require only one person to help, but it does require a certain level of ability from the person with dementia to use safely and to be able to follow one-step instructions. Another device is called a transfer disc. It's a round disc that's placed on the floor under the person's feet so that when you help them stand, they don't have to actually take steps to turn. The disc turns them instead while you're holding them. So the second last level is if the individual needs to use a portable urinal or bedpan. So this is when bed care for toileting is more involved. This may be through most of the day. The individual may be able to get to a commode or to a toilet a couple times during the day, but they're at the stage where most of the toileting is happening in bed. This is where having the right incontinence products and portable urinals handy may be helpful. The person may be able to use a urinal, and this will be different for men and women. There are urinals designed for both, but the one for women doesn't work as well lying down as the one for men would work for them to lie down. So some men are able to either sit at the edge of the bed to use the urinal, and then you're thinking about how they might need help to go from lying to sitting, or they might be lying down and be able to use it. But they will probably need some help holding it and positioning it correctly to avoid spilling. A bedpan may be helpful for bowel movements, if you know when the person needs to go, or for females to use for peeing. I've worked with people who keep a urinal within reach in the living room if getting to the bathroom on time is an issue, or consider having it set up beside the bed for nighttime toileting. So So here's a couple steps that we could do to help with these types of things. The other thing to consider is make sure that you have gloves and a garbage bucket nearby, because things could get messy and you want to make sure that that's going to be as easy as possible and have those things nearby. So the last level of assist is when the person uses a TENS or incontinence briefs. So they may be wearing these incontinence products even if they only need one person to help them to the bathroom. Or they would be using them if they're fully bedbound and are not able to get to the bathroom or use a urinal anymore. So these can include wearing small pads in someone's underwear, wearing a TENS that are like underwear and you just have to pull them up and pull them down, and they have absorbents. They can absorb a lot of urine. Or you can buy underwear that are designed to absorb a certain amount of urine. So it's going to depend on the person and their level of incontinence and the time of day or night. If they're not making it to the toilet anymore and all care is happening in bed, then you'll want to make sure they're wearing durable TENS day and night that will absorb properly, but easy for a caregiver to get on and off. Plus, you may want to have an incontinence pad on the bed underneath them to help protect the sheets. You may also set up a mattress cover to protect the mattress. So sometimes the person can make it to the commode or toilet a few times a day, but need to wear these products overnight, or maybe for an outing where getting to a public bathroom on time will be difficult.